Hello and welcome to DCAR Health. This is my first video, so thank you so much for your time and attention to watch this. I'm going to be testing the hip flexors today, so seeing the flexibility we got around the hip joint. This is called the Thomas test, as you can see in the title. If I'm holding this leg, I'm going to be testing the other leg and then vice versa. I'll give a quick demonstration in a minute. If I see some flexion with the knee bent, it's going to be testing the psoas major. This starts from T12 to L3 of your spine and then comes through anteriorly and posteriorly into the lesser trochanter, which is a little bony landmark in your thigh bone. And then on the other side, another movement we can see is if the leg is straight and rises, then this would be testing the rectus femoris. The reason this differs to the psoas major and how we can differentiate is the fact that it's a two joint muscle. It's going to start at the anterior iliac spine, which here is underneath all this tissue. And then it comes through into the base of your patella, your knee bone, and goes, I'll come a bit closer, through here. Whereas the other quad muscles just split off into the same sort of location, just a different area. So that would be another sign we look out for. The other one which you sometimes see is hip abduction, where it comes out to the side. And that will show some tightness of the tensor fascia lata, which then inserts into what a lot of people term as the ITV. So it's a long tendon which goes through here into your lateral tibial condyle. So I'll get the ball rolling now and see what we find. So I'll make sure the client's heels are level. Make sure the client is fine with everything. Support the leg, take all the weight. Ensure the leg is relaxed and that no muscles are switched on, because you could get a false positive. So I've got the right hip and I'm taking knee and hip into flexion, and straight away we're getting some extension of the knee and flexion of the hip. So remember, two joints, so that would be the rectus femoris. There doesn't seem to be any psoas major or any ITV tightness happening there. So we're going to have a go on the other leg and just compare the two. So same principles, you might not see me on the video, but this leg is the priority for you to focus on, all right? And we'll go through again. And there, we didn't even see a wiggle. So I won't really focus on that one. I've focused really predominantly on that left rectus femoris within therapy rehab, and see if that could be a contributing factor to why the client has come to see me around their injury. Thank you so much for your time. Any feedback is great.